Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about nail infections. So nail infections are called as paronychia in medical terminology. These are one of the commonest infections that we see in practice. Both your fingernails and toenails can get infected. However, the incidence of fingernail infections is much higher than your toenails. So before we get into the infections and why it happens and what are the symptoms, let us first understand the nail in a minute detail. The nail as we know it is the nail plate. The production of the nail starts a little beneath the skin from the nail matrix. The cell starts coming up to the surface of the skin. As they start piling up to the surface of the skin, they get more and more keratinized, or keratin tissue is deposited, because of which they are hardened. Now this hardness is going to be very important for us because at the fingertips are the blood vessels and the nerve endings. So it helps protect them, and beneath the nail we know is the cuticle, and around are the nail folds. So this becomes a compact and a tight structure. What happens in an infection is there is a tear in the cuticle or the nail folds, because of which the microorganisms or the bacteria are going to get entry and cause the infections. So now what are the reasons which will cause a tear in the integrity of the nail fold or the cuticle or the base of the nail? So the commonest are the use of detergents or the chemicals which harm the skin. Then people who work in water for a prolonged time, like your maids in the house, they are more prone to nail bed infections. People who have the habit of nail biting, they kind of spoil the integrity of the skin around the nail, causing it prone to become infection. Plus, people who have other illnesses like rheumatoid arthritis or psoriasis, they tend to have pitted nails or nails with ridges, and the the nail fold is also, integrity is also compromised. So now what happens is when this happens, the bacteria in and around get entry and start causing the infections. So what is the symptom of the infection? The commonest symptom of a new infection is pain, swelling, and the pain is very severe at the tip of the fingers. So pain, swelling. However, a little later what happens is the swelling which looks red starts to become pus filled. Here is the time when the pain becomes absolutely severe. This is what happens in an acute infection. However, with repeated infections, the nail itself starts losing its good or a smooth texture. It becomes rigid, or there are ridges which develop horizontal or vertical, and the nails become brittle. So while people come to us for treatment, the reason they are seeking treatment is that because the nails crack easily or break easily. And we know this is a case of a chronic infection. So let's dwell in the treatment of it. While we seek treatment or while we are treating the patient, we always categorize into two. First is the acute, where the recent infection, and second is chronic, where they have a tendency to the infection for months or years. In acute case, we will only think of the pain, the swelling, the time aggravations of the pain, and prescribe. This is usually a short treatment because they respond faster to treatment. Second is chronic. In chronic treatment, we will take a detailed history of all the complaints, all the stresses they have gone through, other illnesses if any, and a prescription is made. First, if there are pus pockets around, that is the one to improve. With that, the pain and the swelling settles. And a little later, what they realize or what the patients notice is that the structure or the texture of the nail or the nail plate has also started to look healthy like the earlier days. So this is how we treat nail infections. Auxiliary measure or lifestyle measure, the only thing you need to know is that if you are toxic or if your skin is sensitive to detergents, we encourage them to wear gloves while they are using those detergents or working with water. And if you know that a certain chemical, a certain nail paint is irritant to your skin, you should avoid that or remove it as early as possible and wash your hands. I am currently practicing in Saplace Polyclinic, Malik Building, DV Deshpande Mark, Shivaji Park, Road number from 10 in the morning to 8 in the evening. You can also follow me on YouTube, Instagram and Facebook. I am publishing my second book on homeopathic medicines titled Unlocking the Bogus Sign of the Key Part 2 under Vision Publishers. This book is for homeopathic practitioners and doctors, which will help them gain more confidence and knowledge in seemingly difficult cases. Thank you.